A vote for Judge Barrett is a vote to strike down the law that saved the lives of my daughters. And my family is but one of many. While I appear in this room alone, I bring with me millions of families, including 130 million Americans who live with pre-existing conditions, and millions of Americans who dissent from this hearing and any confirmation to the Supreme Court before Inauguration Day. My name is Stacey Staggs, though I'm more frequently addressed as Mommy. I live in North Carolina with my husband and twin girls who have complex medical needs and disabilities. I advocate for their health care, education, and community inclusion with Little Lobbyists, a family-led organization advocating for children like my own. I share Judge Barrett's disdain for hypotheticals. As a behavioral interviewer, I know that past conduct is an indicator of future decision-making. And I am here today because Judge Barrett has repeatedly made statements that are hostile to the Affordable Care Act. A vote for Judge Barrett is a vote to take away health care. And a vote for Judge Barrett is a vote to strike down the law that saved the lives of my daughters. And my family is but one of many. Studies confirm the ACA has saved thousands of lives, especially in states that have accepted Medicaid expansion. And my family is a real-life example of the ACA's success. My twin daughters, Emma and Sarah, are adorable and active 7-year-olds. They're the lights of my life. And we balance a busy schedule of therapies and distance learning. Sarah Bean is my nature lover. She's happiest when she's splashing in the water or digging in the dirt. And Emma has a smile that lights up her entire face. Her favorite day is Tuesday, when we go to the farm for therapeutic horseback riding. I love them with the same joy and amazement I'm sure you feel for your own children. But 7 years ago, their recent birthday would have been too much to hope for. My husband and I were excited to learn we were expecting. We were surprised to learn we were having twins. I had excellent prenatal care, which is one of the essential benefits under the Affordable Care Act, and my pregnancy was going great until one day it wasn't. I was experiencing pain, so my doctor suggested I come down to the hospital for monitoring. And within hours, as my vital signs faded, I was rushed to the operating room where our small wonders were born via emergency C-section at 28 weeks. They were rushed to the neonatal intensive care unit where their survival was far from assured. We sat in vigil for weeks, learning an entirely new language of medical terms and holding our breath in between heartbeats on their monitors. I wasn't able to hold either girl for several weeks, but they were about the size of my hand. They had IVs in every extremity and skin so fragile you could see through it. Emma's birth weight was 1 pound, 9 ounces. She has never taken an unassisted breath or made a sound due to vocal cord paralysis. She has an artificial airway through a breathing tube, and she eats through a feeding tube that was surgically placed when she was 3 months old. Her twin sister, Sarah, was the bigger of the newborns at 2 pounds, and she needed heart surgery at 2 weeks old. That was the day percentages took on a new meaning for me. The surgeon told us his success rate for Sarah's procedure was 98%. Then he leaned in and said, but that doesn't mean much to the parents of the 2%. To this day, when I hear data points and discussion about recovery from COVID-19, for example, I'm immediately transported back to the surgical waiting room. When I was finally able to bring my babies home from the hospital for the first time after 110 days, we received an explanation of benefits with total claims nearing $1 million for their care. And in the first 7 years, our combined claims have surpassed 4 million. Without the protections of the Affordable Care Act, my daughters would have already hit their lifetime caps and now be rendered uninsurable. And we have primary insurance through my husband's employer. Medicaid support has been a lifeline for Emma because she needs 24-hour eyes-on care. Medicaid provides Emma with home and community-based services, including nursing, that allow her to stay home with us, where she belongs, instead of living in a hospital or other medical facility. Our country's in a public health crisis right now, one that's getting worse by the day. In this moment, we need our legislators to protect our families, to provide relief and support, to do the job we've elected them to do. We do not need to rush through the nomination of a Supreme Court justice who is on the record as hostile to the law that provides our healthcare protections. Shifting focus away from a relief package for families during a pandemic tells me the committee's priorities are not aligned with those of the American people. I urge you to listen to us and address the immediate need of COVID relief. Last, I'd like to thank you for the opportunity to give my testimony, to say healthcare is a human right and decency matters, and to remind you that as your constituents, my children and all children like ours are your children too. I hope you'll remember your duty to all of our children as you cast your vote to protect or to take away the healthcare their lives depend on to survive and thrive.